All right, Artificers, welcome back. Go ahead and don your goggles, secure your gear. We are descending once more into the subterranean workshop, the Mind Engine. Now, tonight's work is, well, it's dangerous. It's a deep dive into the seriously volatile mechanics of psychopharmacology. The pressures are high, the chemicals are unstable, but trust me, this knowledge is absolutely essential. So let's fire up the pistons. So, here's our master schematic for tonight. We're going to navigate 6 critical chambers of the Mind Engine, and each one has its own unique machinery and, of course, its own inherent dangers. Get a good look at the layout, because once we start, there's no turning back. Our first stop, the serotonin steamworks. You see, this chamber, it powers our mood, our emotions, our entire sense of well-being. The pipes you see all around us are just humming with serotonin, a really volatile substance that regulates pressure throughout the whole engine. When this pressure is stable, the entire machine just runs beautifully. But when it's not, that's when the alarms start screaming.
And speak of the devil, listen to that. We've got a pressure alert. An operator on sertraline, that's a common pressure regulator, is showing some critical warning lights. We're talking excessive sweating, overactive reflexes, and a dangerously low sodium level in the system's coolant. So what's going on here? What specific meltdown are we witnessing?
This, my friends, is serotonin syndrome. The system is just flooded with way too much serotonergic steam, and it's creating this toxic, superheated environment. The very inhibitors that were designed to maintain the pressure have actually allowed a dangerous surplus to build up. This isn't a small leak. This is a full-blown emergency, a potential cascade failure that could shut down the entire Mind Engine permanently.
Okay, so the crucial point here is to recognize the signals flashing on this diagnostic panel. The alarms from our patient, they're all right here. Hyperreflexia, that's those overactive reflexes. Diaphoresis, which is just profuse sweating. And the hyponatremia, that dangerously low sodium. You'd also be seeing things like shivering, muscle rigidity, a temperature that's just soaring, and a heart rate and blood pressure that are swinging wildly out of control. These are the absolute telltale signs of a serotoninergic overload.
Let's pull up the Artificer's log for sertraline. As an SSRI, its job is to basically block the reuptake ports, keeping that serotonin active in the system for longer. It's a key tool for things like depression and anxiety. But look at the contraindications. You never combine it with other pressure boosters like MAOIs or even something like St. John's wort. And this brings us to a secret blueprint, a critical NCLEX gotcha. When you give this to a severely depressed patient, their physical energy often comes back before their mood actually improves.
This right here, this is the danger. That initial return of energy creates the absolute most dangerous window you can imagine. The patient, they may have had suicidal thoughts before, but they literally lacked the physical energy to act on them. Now, all of a sudden, the medication provides the fuel to act on those very thoughts, even while their mood is still dangerously low. This is not a sign of recovery. It's a code red for suicide risk.
We're descending now to a deeper, much more volatile chamber, the bipolar dynamo. This core, it generates immense power, but it oscillates violently between two extremes. You've got a manic, supercharged state and a depressive, completely powerless state. Taming this dynamo requires a substance of incredible precision and incredible danger.
And yep, there it is, another alarm. A patient who's supposed to be stabilized with lithium is reporting coarse tremors and ataxia. That's a loss of muscle coordination. The whole engine is vibrating violently. Now, the schematics show lithium as a common stabilizer, but its margin for error is razor thin. So what's your immediate priority action? You're the chief artificer. What do you do?
Just look at this. It shows you the fine line we are walking here. At therapeutic levels, somewhere between 0.6 and 1.2, the dynamo just hums perfectly. Its output is stable. But you push that level, and the whole system just starts to tear itself apart. By the time you hit 2.0, you are looking at an imminent core breach.
And this is the critical threshold. This is the number you have to burn into your brain. Once this pressure gauge hits 1.5, the early warning signs of toxicity begin. The coarse tremors, the nausea, the confusion, it all starts right here. This is the point of no return. You have to intervene before it gets any worse.
So the Artificer's log for lithium reveals its secret. It works by interfering with sodium transport. And this is the key, the big NCLEX gotcha. Lithium and sodium are bitter rivals. If sodium levels drop, the kidneys will desperately try to hold on to lithium to compensate, and that's what pushes the patient into toxicity. So things like dehydration, low sodium, even the stomach flu can trigger a toxic event. That's why you never give diuretics. You have to insist on maintaining normal salt and fluid intake.
Now, of course, lithium isn't our only tool. For some of these dynamos, we need less of a chemical balancer and more of an electrical insulator. Anticonvulsants like lamotrigine or valproic acid are used to shield the neural pathways. They literally insulate the wiring of the mind engine, preventing those wild arcs of energy that define manic episodes. But be warned, lamotrigine carries a black box warning for a catastrophic skin failure, Stevens-Johnson syndrome, and I mean it, any rash must be reported immediately.
Next up, we're entering the anxiolytic regulator. That hissing sound you hear, that's the constant, controlled release of overwhelming anxiety pressure. This chamber is filled with valves and dampeners, all designed to keep the system from exploding from stress. But opening these valves carries its own profound risk. Emergency alert! An elderly operator has taken lorazepam. Now they're barely conscious. The respiratory rate is dangerously low. The main pressure valve has been opened way too far and the entire central nervous system is shutting down. What's the reversal protocol? Go!
Okay, let's look at the log for the benzodiazepines. You'll know them by their endings, usually PAM or LAM. Their mechanism is pretty simple. They supercharge GABA, which is basically the brain's primary off switch. Now, this is fantastic for acute anxiety, seizures, or alcohol withdrawal. But if you combine it with other depressants like alcohol or opiates, you get a fatal shutdown. The NCLEX gotcha here is their immense potential for dependence. These are short-term tools, people, not long-term solutions.
And this is the emergency shutdown procedure, flumazenil. This is the reversal cog, the one tool that can slam that GABA valve shut and rapidly reverse a benzodiazepine overdose. Every single artificer has to know its location and its function.
Brace yourselves. We are now approaching the psychosis containment unit. The walls in here are thicker, the shielding is heavier, because the energy we're containing, this raw, unpredictable power of psychosis, it can fracture reality itself.
So we have two main types of shielding here. The first generation, or typical antipsychotics, like haloperidol, think of them as a blunt instrument, a heavy lead shield. They're great at blocking positive symptoms, like hallucinations, but they cause the machinery to grind and seize up. Then you have the second generation, or atypical agents like olanzapine or clozapine. They're more like a refined energy filter. They handle a wider range of symptoms, but they come with their own huge risk. A dangerous, systemic metabolic overload, which leads to major weight gain, high blood sugar, and high cholesterol. And that grinding and seizing I mentioned, this is what we're talking about. Extrapyramidal symptoms, or EPS. They're a direct result of that blunt force first-gen shielding. You get these sudden, agonizing muscle spasms, an unbearable inner restlessness, a shuffling, rigid gait, just like Parkinson's, and worst of all, the potentially irreversible movements of tardive dyskinesia. These are not minor side effects. These are debilitating system failures.
Now, for the acute grinding of dystonia and Parkinsonism, we do have an emergency lubricant, benztropine. This anticholinergic cog can be used to smooth out those motor pathways and stop the painful seizing caused by the older antipsychotics.
And you need to understand this. If EPS is a system failure, then neuroleptic malignant syndrome is a complete containment breach. It's a rare but absolutely fatal reaction to antipsychotic medication. The signs are unmistakable. A fever that skyrockets, muscles that become as rigid as lead pipes, and a total collapse of autonomic function. This is one of the most dire emergencies in the entire mind engine.
All right, moving on. We're now entering the cognitive forge. In here, raw cognitive power is refined and sharpened. We use powerful stimulants to stoke the fires of focus and attention for conditions like ADHD, but stoking these fires too high risks a system-wide overpressurization. So the log for CNS stimulants like methylphenidate shows they work by flooding the synapses with dopamine and norepinephrine, basically supercharging the engine for maximum focus. But this comes at a cost: insomnia, suppressed appetite, which can really affect growth in children, and a racing heart. The critical NCLEX gotcha is their effect on the heart's electrical system. They can prolong the QTC interval, which risks dangerous arrhythmias. This is why a baseline EKG is absolutely essential before starting treatment. And remember, you have to monitor weight and height in kids and always be aware of the high potential for abuse and diversion.
Okay, for our final stop, we're venturing into the oldest part of the mind engine, the alchemist's workshop. The machinery here is ancient, it's powerful, and it's notoriously unstable. These are the tools of a bygone era, and they require an expert hand because their design flaws can be catastrophic.
First up, the tricyclic antidepressants, or TCAs. These are old, powerful mood regulators, but man, are they dirty engines, meaning they have widespread side effects. They're notorious for their anticholinergic properties, which every nursing student learns with that classic mnemonic. Can't see, can't pee, can't spit, and, well, you know the rest.
So, you've got a patient in the ER who has overdosed on a TCA. The alarms are blaring, they're barely responsive. Of all the body's systems being affected, which one is your absolute #1 priority to assess?
The heart, period. Cardiotoxicity is the single most lethal effect of a TCA overdose. Get them on a monitor and run an EKG immediately. That is the priority. Their heart's electrical system is in grave danger. And finally, we have the most dangerous machine in the workshop, the MAOI. This is the nuclear option for depression. Unbelievably effective because it prevents the breakdown of norepinephrine, serotonin, and dopamine. But it was designed with a fatal flaw. If you put the wrong kind of fuel into this engine, it will trigger a catastrophic explosive reaction. That wrong fuel is a substance called tyramine, and let me tell you, it is the basis for one of the biggest exam traps in all of psychopharmacology. Patients on MAOIs must avoid all foods containing it. We're talking aged cheeses, cured meats, fermented products, even red wine. Consuming these will trigger a hypertensive crisis, sending their blood pressure skyrocketing to lethal levels, causing a pounding headache, tachycardia, and potentially a stroke. And with that, our tour is complete. You've seen the steamworks, the dynamos, the containment units. You understand the delicate balance required to keep the mind engine running. But I'll leave you with one final question. Across all of these chambers, what is often the very first universal warning sign that an electrolyte imbalance is brewing and a system is beginning to fail?
Remember this. This is the artificer's golden rule. The earliest sign of any electrolyte disorder is paresthesia, that feeling of numbness and tingling. Whether it's the hyponatremia of serotonin syndrome or the delicate sodium balance of lithium, this is your first warning light. It's the system's quietest alarm, and it's the one you must never, ever ignore. Stay vigilant, artificers.